Hey everybody, Jackie Walter, health and Medicare insurance broker here with Translating Insurance. So I've been getting a lot of questions from my clients who are on different insurance plans. Maybe it's the ACA or Affordable Care Act plans, or perhaps they have a Medicare Advantage plan with co-pays and coinsurance. And there's some confusion about when the doctor says, that service is covered by your insurance. Now, I want to just clear up the misconception that when something is covered, that means it's free. That is not what it means. What it means is that the insurance company is willing to pay the remaining portion of that service after you've already met your deductible or your copay on that particular service. For example, there are ACA preventive services that are covered 100%, but we never know what's going to happen when the doctor goes in and does that colonoscopy, and they may come across some polyps or come across something that they weren't expecting. And while you're, in that procedure, all of a sudden that could go from something that's a preventive 100% covered service to maybe they found some polyps and they need to remove them, and then they have to send them to the lab. And now you're looking at $1,000 bill because what was a covered service, which is still covered, turned into more of a diagnostic issue, and they need to find out if there's other, underlying conditions that need to be diagnosed. Another example is maybe, they are going to do a colonoscopy and an endoscopy at the same time. And the colonoscopy is preventive and covered 100% because it's considered a preventive test in a lot of cases. But the endoscopy is not preventive. That's not on the Affordable Care Act list of preventive services that are required to be covered 100%. An endoscopy is diagnostic. So they're definitely looking for something. And in that case, that service could be subject to your deductible and any copays or coinsurance that you owe on outpatient surgeries. So just wanted to clear that up. It's always a good idea to get an estimate on costs from your provider. But another thing that they do, is they have you sign all those waivers saying, if the insurance doesn't pay, I'm liable. Or, the quote could change after we get into the surgery and find there's other things that we need to do. So I just want you to be aware that when the provider does say that service is covered by your plan, that does not mean it's going to be free. If you have any questions about health insurance, please feel free to reach out to us at Translating Insurance. We're happy to help answer any questions that you have. Thanks.